good idea. Considering the horrible mess that's in his mouth. Okay.
Morning, everybody. We are going to be taking a look at a cat with a tumor inside of his mouth, and he's got some severe dental disease, something called stomatitis. I suspect it's actually something called lymphocytic plasmacytic stomatitis, but we're going to be taking a look and most likely removing all of the teeth in his mouth, and we may be biopsying the gums, but first and foremost, we want to get the tumor out of his mouth. So we're getting ready for that. We'll see you in just a minute. So, this little guy has a tumor right here. It's connected to his cheek and his lip right here and underneath right there. And then we'll get a better view of it when we turn him. I'll take his monitor off for just a second. He's got another one right here. We'll get a better view on the other side. So we are going to remove those. But his mouth is just so inflamed. His gums are very red, very painful. He's already lost some teeth on the bottom from there being so much inflammation and discomfort. All right. You can see on this side, I don't know if you can get in there, the gums are just so irritated. The teeth have so many lesions. We're gonna get all these teeth out, and he's gonna feel so much better. We've done some numbing in the jaw. We're going to work on extracting the teeth that are still present. We're going to do some x-rays to see if there are any hiding below the gums and check to see which roots are still present. I'm not going to remove the tumors until after we're finished taking the teeth out so that there isn't excess bleeding from and so we don't disrupt the stitches from the tumor removal. And this little one's going to be under anesthesia for a little while. He's on a little warm pad. He's got some warm blankets. He's got a little egg that heats the IV fluids right before they go into his catheter. So he'll be nice and warm. He started some antibiotics a few days ago, and he got an injection of an anti-inflammatory this morning, which is already starting to work. So we're decreasing as much of his pain and discomfort as we can so that when he wakes up, he'll be nice and comfortable. We'll check back soon. got your jar?
Yep.
Open? Label that upper left lip slash gingiva. So big U, big L, lip slash gingiva. Got the mass off of the upper left lip and gums. Definitely pretty big, pretty ugly, but got the incision closed, and we'll see about sending it in to identify it. There were a lot of little blood vessels in there. Got those closed up, and now we're going to turn him over, get the other side of the mouth taken care of, extract the other teeth, and remove the other mass, and then he'll be waking up shortly. I'm going to take a look at Charlie's x-rays, make sure we got all the roots removed that we needed to. And so we have digital dental x-rays, much like you might have done when you go into the dentist and they place that little plate in your mouth and everybody leaves the room and that big thing shining on your face. We do that. So this is his upper part of his mouth, and we got all these teeth extracted, all these, so no roots left there. Nothing left along there. Some of this, we didn't do any extractions here. Those had already come out. We did extract there. So we've got stitches along the gums in that spot. It's the lower side. So on his lower left side, we removed the canine. This is his lower right canine. That has just been removed. You can see right here, now it's gone. All right, so for Charlie, we are finished removing the mask. We are finished extracting his teeth right now, and we're going to be stitching up the rest of the gums. My lead technician is going to be suturing the gums right now, and then I'll go in, double check everything else, and we will wake him up, give him a little extra pain medication, and watch him carefully in recovery. He's had a nice amount of IV fluids, so he'll probably have to potty in a little bit. We'll make sure we give him a litter box, and then he'll be going home with oral anti-inflammatories and oral pain medication. And then we'll check his gums in about a week and make sure everything's healing nicely. So I think that's it for right now. We'll see if Charlie wants to give us a little cameo at the end of the visit. All right, so Charlie's awake and Charlie's feeling much better. We will take a look at what's happening. Yeah, I think you're a little bit of a mess maker. That's all right, kiddo. We'll clean up. Good job. Thanks for watching our video, everybody. Don't forget to like and subscribe, and we'll see you on the next one. Thank you.